obstructive sleep apnea, when they go to sleep, their airway kind of closes down. So when it closes down, your brain senses, okay, I'm not breathing, so it wakes you out, pull you out from that sleep stage, and then put you on the wake stage, and then you go back to sleep again, then you quit breathing, then it pulls you back out of the sleep stage again, then, you know, back and forth, back and forth. So you're going to be tired when you wake up in the morning.
People are getting more aware of sleep medicine. You know, if you go back 20 years ago and you ask somebody, how are you sleeping? His wife will tell you he sleeps like a horse, he snores all night. It's great. And then everybody after a while starts to know, you know, if you snore all night and you're tired next day, maybe you're not sleeping well like your wife thinks.
That snoring comes in to play because of the amount of air that you draw in and out of that airway. And if it's narrowed, it'll make that sound, vibrating sound, and that causes the snoring.
We're not getting skinnier, and it seems this is a disease that is heavily linked to obesity and a disease that can worsen or lessen based on people's weight. And so I think, you know, it's so much been in the forefront of the news and common knowledge that you know, Americans are getting flabby, unfortunately, and so the prevalence of the disease is increasing as a result.
So we always recommend our patients to lose weight, exercise. They should avoid taking any alcohol or sedative at night. Any alcohol or sedative will make their sleep apnea worse at night. Any medication you take for sleep will make you sleepy and will make your muscle tone weaker. And we just spoke that, you know, the main problem is in the muscle tone of the upper airway. When this muscle tone is weak, apnea will happen more.
One of the things, if they have hypertension and if they're tired all the time, and if they snore, their spouse complains of the snore, a lot of times most patients, their spouse brings them to the doctor and tells the doctor that, you know, my spouse snores real loud and always tired during the day, and especially when he first gets up in the morning and feels like he didn't go to bed last night, or, you know, those kinds. And then that's when the doctor looks at it, and the doctor pretty much knows what the basic symptoms of sleep apnea is. And so basically it's a hunch that they go on with, which is a pretty strong guess. And then they have a sleep study done to confirm it, and then they order what they call a split night. We're doing 2 procedures in one night. One is a baseline study, which we diagnose the problem. We just don't do any intervening while they're sleeping for approximately 2 hours. We look at we look and see how many times they quit breathing, or they have obstructive sleep apnea or obstructive hypoapnea, and they're snoring if it wakes them up, or if they have oxygen desaturation of less than 3%. Then we pull that in within 2 hours, and that forms our AHI, which is apnea hypopnea index.
Okay.
And then we decide from there, after the 2 hours, whether we need to put them on CPAP or not.
Generally what they're seeing is desaturations of SaO2, so blood oxygen, and they're also seeing apneas. Those are those flatline areas that you would see on the screen. And they can be as short as 10 seconds and as long as 120 seconds. Some of these people actually don't breathe for 2 minutes at a time.
The best treatment available at this time is the CPAP machine. And to get a CPAP machine, first you have to do a sleep lab, get a sleep study, get diagnosed with sleep apnea, you know. And then you go for sometimes for a second phase of the sleep study, which is called the CPAP titration. And this is when we use that CPAP machine to see how much pressure you need. Because the pressure is how much air pressure you need to keep your airway open. It's like somebody blowing in your neck to keep that from collapsing at night. This tube goes into your nose like this, and you hear when you just put it in, the airflow stops, and it just goes with your breathing. When you breathe in, It just gives you air. When you breathe out, it stops and let you exhale. So your body don't feel any continuous pressure into his airway, and as you hear, it's totally silent. You can't hear anything. On and off, it sounds the same. So
it's the CPAP machine where we titrate the patient for the obstructive sleep apnea. So basically, it would hook up like that, and this would push continuous positive airway pressure to the patient. And so the patient with obstructive sleep apnea, this continuous positive airway pressure would open up their airway and make them breathe better at night when they go to sleep.
People that have sleep apnea, if it's not treated, have a high degree of having heart problems, strokes, things down the line, heart failure. And it's one of those diseases that, you know, probably wasn't much at the forefront if you look back 10 to 15, 20 years ago. But people are, it's much more to the forefront. People in the general public know much more about it, are more aware of it. And certainly in the physician community, people are looking, screening for the disease and getting it evaluated and properly treated.